The journey through later life often invites a gentle reevaluation of long-held beliefs, much like the quiet turning of autumn leaves. Among these, a seemingly simple act of daily bathing, a cornerstone of our lives, might hold surprising implications for those navigating the seasoned years beyond 70. Our skin, once a vibrant shield, undergoes subtle shifts, becoming a delicate parchment more susceptible to the insistent stripping of hot water and harsh soaps. This delicate balance, crucial for overall well-being, can be unknowingly disrupted, leading to a cascade of discomfort and vulnerability. Yet a quieter wisdom emerges. Our bodies, in their profound intelligence, possess a remarkable self-cleaning rhythm, a symphony of natural oils and beneficial microbes that thrive when left undisturbed. Moreover, the very act of frequent bathing, particularly in a potentially treacherous bathroom, can subtly erode our strength and heighten the risk of falls, those sudden stumbles that can reshape a life. Experts now softly suggest a different cadence, perhaps bathing just once or twice a week, allowing the skin to breathe and mend, preserving precious energy, and finding cleanliness in simpler, gentler rhythms. This shift isn't a retreat from hygiene, but an embrace of a more compassionate, attuned way of caring for ourselves, a quiet reclamation of comfort, safety, and the inherent resilience of our aging bodies. In the tapestry of a long life, there come moments when the familiar threads begin to reveal new patterns, unseen before. We pause, perhaps in the soft glow of a late afternoon, and look at the world and ourselves with a gentle, questioning gaze. One such quiet contemplation might fall upon the simple, almost ritualistic act of bathing. For decades, it has been an unquestioned truth. The daily shower, the warm bath, a refreshing start, a cleansing end to the day. We've been taught that more washing equals more cleanliness, more health. But as the seasons of our lives turn and we find ourselves in the wisdom-filled years beyond 70, what if this deeply ingrained habit, so seemingly benign, could be subtly working against us? What if the very waters we embrace, the soaps we trust, are in their insistent embrace, whispering away the very essence of our well-being? It's a startling thought, isn't it? Like finding a beloved, worn path suddenly leading into an unexpected thicket. Our bodies, in their profound grace, shift and adapt with age. The skin, that remarkable organ, once supple and resilient, takes on a new delicacy. Imagine it as a cherished old book, its pages thinner, more translucent, its binding a little more fragile. Decades of living, of sunlight and laughter, of worries and joys leave their gentle imprints. Scientific minds, gazing deeply into this miracle of aging, have illuminated these transformations. The outermost layer, once robust, now holds less density, while the deeper layers, sustained by the vital threads of collagen and elastin, soften. The tiny wells within our skin, the sebaceous glands that once flowed freely with natural oils, now offer their bounty more sparingly. Even the sweat glands, quiet custodians of moisture, become less active. The result is a complexion that is not only drier but far more exquisitely vulnerable, lacking the protective, oily embrace it once knew. For us in these tender years, the daily ritual of bathing, particularly with water that is too hot, or with soaps that are too eager in their cleansing, can turn this natural vulnerability into a quiet challenge. Each time the water flows and the suds form, they can, without malice, gently strip away the dwindling reserves of our skin's protective oils, leaving it exposed like a garden without its nurturing dew. Dermatologists, those who have spent their lives understanding the skin's whispers, observe that this process isn't merely about superficial discomfort. It sets off a delicate chain reaction. First, a subtle dryness, a tight, almost prickly sensation. This often deepens into a persistent nagging itch, as the skin's compromised barrier sends out signals of irritation. In more pronounced instances, a condition known as psoriasis can take hold. Imagine the skin as a landscape, becoming rough, sometimes even subtly scaly, dotted with tiny, almost invisible cracks that can sting with every gentle movement. These minute fissures, though small, are not to be They can at times become silent invitations for unwanted guests, tiny bacteria or fungi, or gently worsen underlying conditions, like a quiet inflammation. Beyond the physical sensations, this over-enthusiastic cleansing can subtly impact the quiet rhythms of daily life. Imagine the frustration of constant itching that gently disrupts sleep, or the subtle discomfort of flaky skin catching on clothing throughout the day. For those whose steps are a little less sure, or whose joints carry the gentle wisdom of arthritis, the effort to bathe daily can already be taxing. Adding skin discomfort to this equation only deepens the burden. Research, like a gentle hand revealing a truth, suggests that hot water, in particular, quickens this subtle harm, dissolving the delicate fatty compounds crucial to our skin's protective veil, while alkaline soaps with their different pH can disrupt the skin's natural slightly acidic balance. For us, this isn't simply about appearance or fleeting comfort. It's a quiet health consideration. Compromised skin struggles to gently fend off the unseen invaders, potentially leading to small infections or gently worsening chronic wounds. What begins as a well-intentioned act of care can, over time, subtly lessen our resilience, making us consider with gentle thoughtfulness how often we step into the embrace of the shower. Here is a revelation that might cause a quiet pause, a gentle shift in perspective. In a world where cleanliness often dances hand in hand with frequent washing, for those of us beyond 70, bathing less often might surprisingly strengthen our quiet defenses against infection. This is not mere speculation, but a finding grounded in the patient unfolding of scientific understanding. Researchers, like quiet observers of life's patterns, have tracked the journeys of older adults and discovered a striking truth. Those who gently reduced their bathing frequency experienced fewer of those small, almost invisible skin tears. Unlike the resilient skin of youth, which bounces back with astonishing ease from tiny scrapes, our aging skin is like the finest paper, slow to mend. Tears in this delicate tissue heal at a more leisurely pace, a consequence of diminished blood flow, a gentle tempering of the immune system, and a slower rhythm of cell renewal, all the quiet hallmarks of age. These small open whispers on the skin can become silent gateways for tiny bacteria, which can trigger gentle inflammations, or even deeper concerns in severe cases. The quiet connection between our bathing habits and these delicate skin tears lies in the intimate dance of water and soap with aging skin. Frequent washing, especially with hot water, gently erodes the lipid layer, that microscopic, almost invisible shield of fats and oils that delicately hold our skin cells together and keep moisture with. Harsh detergents amplify this subtle damage, breaking down proteins, leaving the skin a little more brittle, a little more prone to splitting under the slightest pressure. Imagine pulling on a favorite sweater, or gently brushing against a textured surface. Even these small acts can cause a micro tear. Scrubbing, that common habit to feel truly clean, adds a gentle mechanical stress, subtly weakening the skin's delicate structure. Over time, this quiet, relentless cycle of washing and drying can create a quiet landscape of tiny abrasions and tears, each a potential entryway for unseen pathogens. By contrast, seniors who bathe less, perhaps every other day, or 2 to 3 times a week, offer their skin a quiet grace, a chance to gently retain its natural oils, and patiently rebuild its subtle defenses. Spot cleaning with a damp cloth for areas like the underarms or groin can maintain a sense of freshness, without subjecting the entire body to a full rinse. The quiet benefits of this gentle approach extend beyond warding off infection. Fewer skin tears mean less pain, fewer quiet worries, and a reduced risk of those small complications that can, at times, spiral into a longer journey to the doctor, or even a hospital stay. Critical considerations. For those whose mobility might be a little less fluid, or whose resources are a little more finely tuned. For us, the bathroom, that most personal of spaces, is not merely a place for grooming. It can at times become a quiet zone of potential peril, and daily bathing with its inherent demands subtly heightens the stakes. The American Geriatric Society, like a watchful elder, has gently sounded the alarm, emphasizing that falls rank among the leading causes of injury and even in the most profound moments of death for older adults. Statistics, when viewed with a gentle eye, paint a clear picture. More than 1 in 4 adults over 65 experiences a fall each year, and these incidents quietly account for millions of emergency room visits, countless fractures, and a significant number of heartbreaking fatalities. For those of us past 70, the risk gently escalates as muscle strength softens, reflexes take on a more deliberate pace, and conditions like arthritis or neuropathy can subtly erode balance and stability. Wet, slippery surfaces, think of glossy tiles slick with soap suds, or a tub's smooth enamel, transform bathrooms into a subtle landscape of challenge for seniors already gracefully grappling with mobility shifts. Daily baths amplify this quiet peril in ways that might not immediately register. Each journey to the shower requires navigating a gentle gauntlet, stepping over a tub ledge, balancing on one leg to enter, or carefully maneuvering out while still dripping. Add in the soft mist of steam, obscuring vision, the gentle disorientation of warmth, or the quiet fatigue of standing for too long, and the odds of a small misstep subtly increase. Bathing routines often coincide with moments of peak fatigue, whether it's the gentle grogginess of morning or the quiet exhaustion of evening, further deepening the risk. A fall in this intimate space isn't just a bruise or a scare. It can mean a broken hip, a quiet brain injury, or a spiral of complications that subtly erode the precious gift of independence. Contrast this with a gently reduced bathing schedule, perhaps once or twice a week, tenderly supplemented by sponge baths or basin washes for key areas. This simple, quiet adjustment gently slashes the number of high-risk bathroom visits, cutting exposure to that potentially treacherous environment by half or more. The quiet trade-off here is clear. Spotless cleanliness pales in comparison to physical safety. A little dirt, a subtle perspiration, or a faint odor pose far less threat than a fractured bone or a quiet concussion. For seniors living alone or with limited support, avoiding a fall could mean the profound difference between staying in the cherished comfort of their own home and transitioning to a different kind of care. Practical adaptations like installing grab bars, using non-slip mats, or gently switching to seated showers can help, but reducing bath frequency quietly addresses the root issue. Fewer trips, fewer chances for a stumble. Prioritizing safety over an arbitrary standard of daily hygiene isn't just prudent. It's a life-affirming recalibration of priorities that places well-being, in its deepest sense, first. It might sound like a bold whisper, but your body, in its profound wisdom, is equipped with a remarkable self-cleaning system that operates without a single drop of water or a bar of soap. This is not some new age musing. It is biology, at its quiet, elegant work, refined over millions of years of patient evolution. The skin, far from being a passive canvas, is a living, breathing ecosystem, teeming with beneficial bacteria, natural oils, and a finely tuned balance of pH and moisture. These elements, like tiny unseen collaborators, work in quiet concert to keep it healthy, resilient, and surprisingly clean. For us whose skin already carries the gentle marks of age, overbathing can subtly disrupt this intricate silent machinery, washing away the very allies that offer protection. Gently scaling back on showers, allowing the body to simply be, can preserve this natural harmony, offering a compelling truth. Sometimes nature truly knows best. At the heart of this self-cleaning marvel is the skin microbiome, a bustling, invisible community of microorganisms, bacteria, fungi, and even microscopic mites that gently colonize its surface. Far from being unwanted guests to be eradicated, many of these microbes are quiet, symbiotic partners. Certain species gently feast on dead skin cells, perspiration, and excess oils, breaking them down into harmless byproducts, while quietly outcompeting harmful pathogens. These beneficial bacteria even produce tiny antimicrobial compounds, like invisible shields that gently fend off invaders. Meanwhile, sebum, the delicate, oily secretion from our sebaceous glands, softly coats the skin in a protective film, trapping moisture and gently repelling dirt. And dead skin cells, in their own quiet way, gently shed naturally through a process called desquamation, carrying away grime along with them. Together, this silent trio, microbes, oils, and cell turnover, keeps the skin in a state of dynamic, living equilibrium. No scrubbing, no harsh soaps, just the gentle dance of life. Frequent bathing, however, can gently throw a wrench into this elegant system. Hot water dissolves sebum, leaving the skin subtly parched and defenseless. Harsh soaps, with their higher pH, can quietly kill off the friendly bacteria, disrupting the microbiome's delicate balance and gently paving the way for irritation or infection. For us whose oil production is already a little more reserved, and whose microbial diversity softly wanes with age, this overzealous cleaning can gently tip the scales from health to subtle harm. Research, like a patient investigation, suggests that excessive washing correlates with higher rates of dryness, gentle eczema flares, and even quiet allergic reactions, all signs of a system a little out of sync. By contrast, bathing just a few times a week, perhaps with mild pH-balanced cleansers when truly necessary, allows the skin to stabilize, to find its quiet scent. Odor, often the biggest quiet concern, can be managed with targeted washing of high sweat areas like the underarms or groin, leaving the rest of the body to its natural, gentle rhythm. For older adults, this approach isn't just practical, it's quietly liberating. It gently reduces the physical demands of bathing, preserves the integrity of our skin, and quietly aligns with how the body was designed to function. Historical whispers bolster this understanding. Humans thrived for centuries with minimal bathing, relying on nature's quiet toolkit, long before daily showers became a cultural norm in the 20th century. We, in our wisdom years, can take a quiet cue from that ancient resilience, trusting our bodies to maintain a baseline of cleanliness and health. The gentle result, skin that is less irritated, more balanced, and better equipped to gently fend for itself. Proof that stepping back from the soap can sometimes be a quiet step forward in our profound well-being. Prepare for a quiet revelation that might gently reorder everything you've been taught about personal hygiene. Leading experts in geriatrics and dermatology now softly recommend that seniors bathe just once or twice a week. This isn't a call to abandon cleanliness or let our standards gently slip. It's a deliberate evidence-based shift, carefully tailored to the unique, delicate needs of aging skin and bodies. Far from neglect, this approach reflects a growing, gentle understanding of how overzealous washing can quietly harm rather than help those of us over 70. It's a radical departure from the daily bath mantra ingrained in modern culture, but one that is quietly gaining traction as science gently peels back the layers of what truly keeps us healthy in later life. The recommendation comes from a quiet chorus of authoritative voices, dermatologists, geriatricians, and researchers who have patiently studied the intricate interplay between aging and hygiene. Guidelines from respected organizations and insights from specialists gently underscore that frequent bathing isn't a one-size-fits-all necessity. Aging skin, as we've come to understand, is thinner, drier, and less oily, making it subtly prone to damage from water and but the gentle advice goes beyond skin deep. It's about aligning hygiene with a senior's overall condition. Experts softly emphasize that bathing frequency should gently hinge on individual factors, activity level, health status, and personal comfort. A quiet retiree who spends most days indoors, for example, generates far less perspiration and grime than a younger active person, or even a senior who tends a garden daily. Someone with specific needs might require targeted cleaning, but a full-body soak, perhaps not so much. This tailored, gentle approach subtly dismantles the outdated notion that daily baths are a universal gold standard, a rule rooted more in 20th century marketing than in deep medical need. Consider the gentle evidence. Studies show that overbathing quietly correlates with higher rates of skin breakdown, irritation, and even gentle pressure sores in frail adults, while less frequent washing patiently preserves the skin's natural defenses. Practicality plays a quiet role too. Bathing once or twice a week, gently supplemented by spot cleaning with a soft washcloth for areas like the face, hands, or groin, maintains a sense of freshness without the gentle toll of a full rinse. Experts also gently point out that odor, often the biggest driver of frequent bathing, is manageable with minimal quiet effort. Deodorant, a quick wipe, or a change of fresh clothes can often suffice. For us, this isn't about cutting corners. It's about adapting intelligently to what our bodies gently demand, proving that less can be more when guided by science and a quiet, profound common sense. Bathing might seem like a simple, effortless task, but for many seniors beyond 70, it can be a quietly demanding ordeal that exacts a subtle physical toll. The Journal of the American Medical Association has gently spotlighted this often overlooked reality, detailing how the act of washing can quietly drain energy reserves, subtly strain aging bodies, and even trigger debilitating symptoms. What feels routine in youth, stepping into a shower, standing under a warm stream, or gracefully climbing out of a tub, subtly morphs into a quiet marathon of effort. As muscles gently weaken, joints softly stiffen, and stamina gradually fade. Gently scaling back to fewer baths doesn't just protect delicate skin or reduce fall risks. It conserves precious energy, transforming bath time from a burdensome chore into a manageable, even peaceful ritual. The physical demands of bathing are multifaceted, and Gemma's research quietly breaks them down with a sobering clarity. For starters, standing for 10 or 15 minutes under warm water can subtly tax the cardiovascular system, especially for seniors with gentle heart conditions or poor circulation. The warmth gently dilates blood vessels, potentially causing a drop in blood pressure and leaving one feeling quietly dizzy or lightheaded, a subtle recipe for a faint in a slippery space. Then there's the gentle breathlessness. Those with chronic obstructive pulmonary disease, COPD, or subtly weakened lungs might quietly struggle to inhale steamy air, panting through what should be a relaxing moment. For the millions of seniors with arthritis, almost half of adults over 65, every gentle movement can hold a quiet ache. Bending to wash feet, reaching to gently scrub the back, or gripping a bar of soap can gently inflame creaky joints, turning a bath into a quiet gauntlet of pain. Even stepping in and out of a tub demands a balance and strength that may no longer come easily, especially if neuropathy has gently dulled sensation in the feet. The aftermath is just as quietly taxed. Toweling off, gently drying hard-to-reach spots, and dressing afterwards subtly sap what little energy remains, leaving some seniors so quietly wiped out they need to lie down. Gemma notes cases where this exhaustion lingers, quietly cutting into the day's activities. Think skipping a gentle walk, missing a meal preparation, or softly dozing off instead of engaging in a quiet conversation. For those with frailty or chronic fatigue,
daily bathing can gently tip them into a cycle of depletion, subtly eroding their independence. Contrast this with a lighter schedule, bathing once or twice a week, perhaps with a chair in the shower, or a handheld nozzle to ease the gentle strain.
This preserves stamina for what truly matters: playing with beloved grandchildren, tending a cherished hobby, or simply enjoying the quiet grace of the day. Studies gently back the benefits. Reduced bathing frequency correlates with lower reports of fatigue and an improved, quiet mood among seniors, suggesting that energy conservation boosts not just physical health but mental well-being too. For older adults, dialing back the shower routine isn't a concession. It's a strategic, gentle choice to reclaim vitality and keep bath time from becoming a quiet battle. Here is the biggest, most liberating shift of all: a quiet paradigm shift. Hygiene isn't synonymous with a full-body bath. And for seniors, that's truly liberating news. The idea that cleanliness demands a daily soak is a cultural relic, not a universal truth, and modern alternatives gently prove you can stay fresh, healthy, and dignified without ever stepping into a shower or tub. Wet wipes. The simple act of hand washing, gentle oral care, fresh clothes, and regular grooming form a quiet toolkit of smart, tailored self-care that elegantly sidesteps the risks of frequent bathing while keeping seniors comfortable and confident. This isn't about lowering our standards. It's about redefining them to fit the gentle realities of aging, proving that effective hygiene is less about the volume of water and more about strategic, individualized choices. Consider the options, each a practical, quiet powerhouse in its own right. Wet wipes, those pre-moistened marvels, offer a quick, gentle way to clean key areas like the underarms, groin, or face, where perspiration and bacteria tend to gently gather. They're soft enough for fragile skin, require no rinsing, and eliminate the need to stand or balance in a potentially slippery space. Hand washing, a cornerstone of infection prevention, gently tackles dirt and germs where they're most likely to linger. Fingertips that touch doorknobs, food, or faces, without subjecting the whole body to a wash. Oral care, often quietly overlooked in the bathing debate, is a hygiene heavyweight. Brushing teeth, flossing, and using mouthwash banish bacteria that cause odor and disease, keeping breath fresh and health intact. Fresh clothes, light and breathable fabric swap daily, gently wick away moisture and odor, while a quick comb through or wipe down of hair maintains a polished, composed look. Add in targeted solutions like deodorant or a gentle spritz of body mist, and you have a regimen that delivers results without the rigors of a full rinse. This approach isn't just convenient. It's a quiet game changer for seniors gracefully navigating physical or environmental hurdles. Picture an 80-year-old with shaky hands or a tender knee. Wrestling with a shower head or climbing into a tub might be daunting, but gently wiping down with a cloth or swapping a shirt is gracefully doable. For those in colder climates where wet hair and chilly bathrooms invite shivers or pneumonia risks, dry shampoo or a warm washcloth often quietly beats a full bath. Studies gently support this shift. Research in geriatric nursing highlights that seniors using such bathing alternatives report feeling just as clean and socially presentable as those who bathe daily, with fewer skin issues or fatigue complaints. It's a dignity-preserving strategy, especially for those with caregivers, since it empowers them to maintain hygiene on their terms, not a rigid one-size-fits-all schedule. Hygiene, it turns out, is less about soap suds and more about what truly works for the individual, making it a flexible, low-risk art form for seniors to master. So in the quiet wisdom of our later years, the daily bath ritual, long celebrated as a cornerstone of health and propriety, might be subtly undermining our well-being. The evidence is gently accumulating, and it's a truth hard to ignore. Aging skin, with its thinning layers and fading oils, suffers under the quiet onslaught of frequent washing, becoming dry, itchy, and subtly cracked. Safety concerns loom large, with slick bathrooms posing a fall risk that far outweighs the quiet threat of a little dirt. Energy demands climb, draining stamina from bodies already gracefully stretched thin. Yet the body itself offers a counterintuitive wisdom. Its natural cleaning systems, from beneficial bacteria to gently shedding cells, truly thrive when left in their quiet harmony. Together, these factors point to a beautiful, new truth. Less frequent bathing, perhaps once or twice a week, gently tailored to personal needs, could unlock healthier skin, fewer quiet hazards, and a richer quality of life. This isn't a one-off hunch. It's a gentle convergence of science and practicality, softly backed by experts from dermatology to geriatrics. They all chime in with data showing that overbathing harms more than it helps, while reduced routines gently protect and preserve. Picture the benefits: skin that stays supple instead of scaly,
Mornings free of exhaustion or treacherous slips. Energy saved for a quiet walk or a heartfelt chat instead of a shower slog. It's not about abandoning hygiene, but reimagining it, swapping the tub for a wipe, the soak for a fresh shirt, and trusting the body to handle the rest. The key is customization. A marathon running 75-year-old might need more than a bed-bound peer, just as climate, culture, or health conditions gently shape the ideal rhythm. That's why a quiet conversation with a trusted healthcare provider is so crucial, whether for yourself or a loved one. They can gently pinpoint the perfect balance, blending medical insight with personal quirks. Who knew that stepping back from the tub could be a quiet step toward better living? It's a gentle revolution in self-care, quietly flipping decades of habit on their head. For us, it's a chance to shed an outdated burden and embrace a lighter, safer, more vibrant way to age, one that honors the body's quiet wisdom over society's sometimes insistent rule. Less water, less risk, more life. That's the unexpected promise of bathing less, and it's a truth worth soaking in. In the quiet tapestry of our lives, as the years gently fold into one another, we find a deepening appreciation for stillness, for the subtle rhythms that sustain us. May this gentle understanding, this quiet wisdom about our bodies, bring you a profound sense of ease and comfort. May you find strength in simplicity, and discover the quiet power of honoring your body's own gentle inclination. Embrace the peace that comes from knowing you are deeply cared for, by your own gentle hand, and by the inherent resilience of life itself. May your days be filled with quiet grace, gentle well-being, and a profound sense of peace.